yung basket. Tapos siguro lagyan lang
Maisel Zafra is preparing this special basket for her newborn. She's expected to deliver anytime soon. Maisel hopes this protective basket will keep her baby safe from the coronavirus.
Ando naman yung face niya sa pinakaloob. So, hindi naman siguro siya matatalsikan ng kahit anong fluid or what.
But what's meant to be a special time in her life is instead filled with fear and anxiety because of the pandemic. That's why she's been extra careful. She says she's constantly disinfecting everything, especially when she or her partner steps out of the house.
Nakaka-stress kasi ang dami mong hindi magawa. Tapos syempre takot. Kasi hindi siya usual times na safe lumabas, safe magpunta sa hospital.
Maisel also skipped a number of her prenatal appointments because of movement restrictions during the lockdown. Most of her regular consultations were done over the phone.
Hindi ka niya personally ma-check So, i-explain mo lang pero hindi niya makikita kung gaano kalaki na talaga yung tiyan mo. Hindi niya ma-check si baby.
Maisel is scheduled to have her baby at a private hospital. She has set aside 150,000 pesos, but because of the pandemic, there's an additional 50,000 that she needs to shell out to pay for things like a swab test, which would cost anywhere from 5,000 to 8,000 pesos. She's also been told if protective gears of doctors run out at the time of the baby's birth, she would need to pay extra for those too.
Sana naman, meron pa. Walang assurance na kung maubos, hindi ba sasagot yung patient. So, ayun. So, kailangan ready ka rin. Mabigat na on its own magbuntis. Pero ngayon, ang daming extra na expenses.
Expectant mothers are required to be cleared from COVID-19 before giving birth. Tests are meant to be done on the 37th or 38th week of the pregnancy.
The COVID testing is required, especially for those who would undergo elective cesarean section, other procedures. Kailangan ma-triage na namin ng maayos that these women will not be mixed with those that have positive COVID.
The Philippine Obstetrical and Gynecological Society is also proposing universal COVID-19 testing for all pregnant women so families don't have to bear the cost. And the Health Department hopes high-risk pregnancies will be covered starting this week. For some who are thinking of having their babies at home, medical experts are discouraging against it due to possible complications.
Hypertension, postpartum hemorrhage, or infections.
And for those worried about going to the hospital and catching the disease, hospital officials assure COVID-19 patients are isolated. Expectant mothers also have the option to go to lying-in clinics or government hospitals to help manage costs. Caroline Bonquin, CNN Philippines.